The Gesetz zur Modernisierung der Gesetzlichen Krankenversicherung, a case study in unintended consequences. I just remembered the Gesetz zur Modernisierung der Gesetzlichen Krankenversicherung, also known as the health reform of 2004. It was about making the system more efficient. Part of this was the introduction of a patient co-payment, €10 per quarter for the practice, 10% co-payment for medicines and medical devices, at least 5, and a maximum of €10. The politicians had the idea that we go to the doctor for fun, and thus place unnecessary strain on the system. A popular claim was that seniors constantly make doctors' appointments so that they can read magazines in the waiting room. The co-payment for medicines and medical devices was mainly based on the idea that people would get medication prescribed by the doctor for fun, and thus place unnecessary strain on the system. Medical devices would be crutches, wheelchairs, etc. Everyone was against it when it was introduced. Doctors, patients, and health insurance companies were not happy either. Slowly two things happened at the same time. People said to themselves, if I have to pay, then it should be worth it. On the one hand, that meant that if you had already paid for the quarter, you tried to squeeze in as many doctor's appointments as possible. On the other hand, towards the end of the quarter, hardly anyone went to the doctor who hadn't already paid. So doctors' offices were totally overcrowded at the beginning of the quarter and very empty at the end. I don't know how many politicians' speeches I heard, radio and TV discussions, newspaper and magazine articles saying that people should be reasonable. People should go to the doctor on the last day of the quarter and of course pay the full fee for the quarter instead of going the next day and have a full quarter. Amazingly, the practice fee was already withdrawn at the beginning of 2013. It is therefore amazing that our politicians normally hardly withdraw any law. Unfortunately, the co-payment for medicines and medical devices remained.